So our next item, it gives me great pleasure to invite Dr. Keith Ridge, who is the Chief Pharmaceutical Officer for England, and is the head of our pharmacy profession and the principal advisor for pharmacy and medicines use. And his role supports Department of Health and Social Care and the government, as well as Health Education England. And Keith is the reason we have the Global Health Pharmacy Fellowships. It is a CPhO fellowship, so it is part of his cohort of fellowships that he has been leading and has sponsored and has made happen throughout in England, but for this particular one across the UK. So Keith, I'm just going to hand over to you now. Thank you so much for your support.
Okay, thanks Diane, and hi everyone. And first thing to say, obviously, is many congratulations to the first Chief Pharmaceutical Officers Global Health Fellows. Congratulations. So I just thought I'd say a few words to sort of get the ball rolling on what should be a really exciting and interesting day. So I know these are challenging times, and I just wish we could all be together in person to celebrate and enjoy the day even more. But I'm sure we'll make the most of it, and personally, I'm really looking forward to hearing about all your experiences. My first real encounter with global health was back in the 1990s. I was sitting at my desk in the Department of Health, where at the time I was the lead on hospital pharmacy and prescribing, after which I went off to Glasgow for a few years, where I was chief pharmacist there. Back at the Department of Health, I got a call from someone called Nigel, and now Lord Crisp. Just then, he'd been the chief executive of the NHS in England and had been commissioned by the Prime Minister at the time, Tony Blair, to examine global health issues. He later published a report, and that report has had an important impact on how the UK approaches global health, and recognising the benefits, not just of the UK, but beyond. Anyway, Nigel had returned from an African country where, in a meeting with the country's health minister, he asked what was the one thing he could do to help. And the minister's answer straight back was to provide that country with more pharmacists. And that was in part because of insecure and inadequate medicine supply chains, limited range of medicines, the associated infrastructure, and I guess a low skill, but maybe more importantly, insufficient workforce. We were able to contribute some expertise to help improve things, but one of the things that struck me was talking to the UK, when I talked to the UK people involved, was not just how the country concerned had benefited, but how much the UK pharmacists as individuals have benefited in their approach to work and ultimately leadership and in due courses, of course, the services they deliver to patients in the UK. Of course, Nigel is not only now an authority on global health, but also patron of the Tropical Health and Education Trust, THET. And I know he's impressed by how well the Commonwealth PAMS scheme and programme is progressing. I was involved with AMR in the 90s too. Indeed, I've worked with 4 CMOs on antimicrobial resistance, I'm proud to say. And I'm also proud to say that over that period, the role of pharmacists in antimicrobial stewardship has grown from, I guess, what some people would call interested parties to being leaders in the field. And indeed, I've just appointed a senior and experienced AMR pharmacist as the National Stewardship Pharmacy and Prescribing Lead for the NHS in England. And that person will be supported by 7 new regional leads, all of whom will be pharmacists. And that's all part of the UK's latest antimicrobial resistance strategy. And it builds on the growth in specialist stewardship pharmacists over the years. And of course, it's Sally Davis, who we all know has made and continues to make an enormous impact on how the world approaches AMR. Both Sally and I also know that it's early to mid-career professionals that at the end of the day will drive healthcare forwards. So when the opportunity came to improve stewardship in some low and middle income countries, through the Fleming Fund, and in due course, the relationship between CPA and THET, it just seemed natural to me to try to make sure that the pharmacists involved should, in due course, become the sort of, if you like, the kernel of the future of the UK pharmacy's expanded contribution to global health matters in the future. So hence the fellowship, and I'm very grateful to Health Education England and the Centre for Pharmacy, Pharmacy Postgraduate Education, and Chris Cutts, Matthew Shaw and Jed Byrne in particular, I think we're hearing from Jed later, for helping to make the fellowship happen. I know Sally, in her new role as the UK's AMR Special Envoy, and indeed a Department of Health here in the UK, are looking at the scheme, and like me, I'm sure would like to see, if possible, it's not just to continue, but to expand. And we eagerly await the evaluation, which will be an important part of deciding whether to do that or not. And in due course, the Global Chief Pharmaceutical Officers Fellows will join my growing alumni of other clinical fellows, early to mid-career leaders of the future. Of course, successfully delivering improvements in stewardship needs clinical expertise. And across the UK, we're seeing a huge expansion in the development and utilisation of clinical pharmacy. For example, in primary care, where thousands of prescribing clinical pharmacists are being deployed into primary care networks and general practice to improve safety and outcomes for patients from medicines. Or in community pharmacy, where the provision of clinical services is expanding. All, of course, building on the established but growing use of clinical pharmacy teams in hospitals. We now have a few more things to consolidate, in my view, to consolidate that progress. First is to integrate those teams so that they work across a multi-professional, collaborative system and not in a silo. Secondly, we need a sustainable supply of prescribing pharmacists with the right clinical skills and competencies, supported by clinically and managerially skilled pharmacy technicians. And UK pharmacy education and training is about to undergo major transformation to not only deliver that sustainable supply, but to deliver a workforce active in clinical research, delivering rewardable and enjoyable clinical careers, and more importantly, better care for patients. And thirdly, we need to support the current pharmacy workforce in developing their clinical skills further, and we will continue to invest in all of these things. And helping to combat antimicrobial resistance through good stewardship will be at the heart of what clinical pharmacy teams will do. It will become an even more of a part of mainstream pharmacy practice, alongside reducing the burden of polypharmacy, reducing unnecessary medicines use, including reducing addiction to prescribed medicines, improvement in long-term conditions, and also utilising modern, more effective treatments. But we must do all of that as part of a multidisciplinary team, and very importantly, in partnership with patients and citizens, where shared decision-making is central to professional practice. We will get effective COVID vaccines, but I guess we're all concerned that there might be a COVID legacy of losing some of the stewardship gains of recent years, and what some might see as excessive use of antibiotics. Early signs, in England at least, are that might not be the case, but winter is approaching, and more ITU bed occupancy will understandably mean more antibiotic use. And in primary care, one can see the challenge of seasonal flu and COVID running together, hence the enormous importance of vaccination, both seasonal flu and COVID. All pharmacists need to promote vaccination whilst guarding against inappropriate antibiotic use in the months ahead. A lot of our resources are focused on COVID and recovery right now, and rightly so. but we must do all we can to ensure good stewardship throughout. The risk of antimicrobial resistance remains, hence the UK's 20-year vision and 5-year National Action Plan, which are still as important as ever. The long-term plan is still a major focus for the NHS, and the importance of medicines optimisation runs throughout the plan. The Antimicrobial Resistance National Action Plan is alive and well and continues to be an important priority. But when we emerge from the pandemic, it would do no harm at all, in my opinion, to remind decision makers about the risks of AMR. It is not yet as imminent as the risks from COVID, but as we see with COVID, bugs travel, and that includes those resistant to antibiotics. So pharmacists with experience of seeing and helping with the challenges of stewardship in low and middle income countries will be invaluable. As I conclude these few words, I must also pay tribute to the Commonwealth Pharmacists Association and to THET. The CPA has always been on my mind across my career. I've seen, albeit at a distance, the important work it does. Occasionally I even help, for example, with redistributing old BNFs. But it was this scheme, the Commonwealth PAMS scheme, that has drawn me closer to the CPA. And I can't congratulate them enough in proposing and getting the scheme going. All the pharmacists listening to this today should have a look at the CPA's website and see what they can do to help. THET was a new body to me. I suspect it's a new body to many pharmacists. As I've got to know THET a little more, Ben Sims, the CEO, and his team, I've seen a little glimpse, if you like, of the amazing work that they do, and not only that, the distinguished history of a dedicated organisation. And I would encourage both THET and the pharmacy profession to get to know each other even more, perhaps through an enduring partnership with the CPA and the Royal Pharmaceutical Society. There is no doubt in my mind that as many pharmacists as possible should, particularly when we can all travel again freely, consider spending some time working abroad in low and middle income countries to help develop the expertise needed, but also to bring back that experience to the NHS. Of course, you need a willing NHS employer to support this. So thank you to the chief pharmacists in the audience for supporting your staff's development. And I hope you agree it brings advantages to your organisation too. And finally, a big, big thank you to Sarah, Diane and Vicky, and to the THET team for the superb leadership they have demonstrated in making the scheme happen. Well done to everybody, and congratulations again to the new CPhO Global Fellows. Thank you.